There was a big court hearing behind closed doors, apparently Friday, a federal judge hearing arguments. This is the lawsuit, Cedric, and it's real complicated. Maybe you can boil it down. The lawsuit BRF and Vantage Health Plan filed having to do with Willis Knighton. Can you unravel what this lawsuit is about and how it's kind of connected to this whole issue?
Well, it's really not that complicated. And part of the reason as to why the folks from BRF stepped into this void to offer to manage a hospital is they recognize that Shreveport right now suffers, Northwest Louisiana suffers from being essentially a medical monopoly in that one provider, Willis Knighton, has over 77% market share. And also folks who are in the insurance business who either do business here now or want to come into this market are burdened with having to pay reimbursement rates for any number of common medical procedures that are 3 times higher in Shreveport-Bossier than they do in other parts of the state. So that same thing that you pay $100 for, or your insurance carrier, or you and your insurance carrier would pay $100 for in New Orleans and Alexandria, Lafayette, Baton Rouge, cost you $300 here in Shreveport.
Really?
Because of yes, that's what's at the core of this lawsuit, and it's at the core of why it is that there is an effort to try and ensure that we have a competitive healthcare market in Northwest Louisiana, because a lack of competition drives up costs and drives down quality.
Now, the lawsuit also alleges that Willis Knighton is trying to steal commercially insured patients. Is that accurate?
Well, that goes back to what I mentioned earlier about the Shreveport Medical School and Medical Center hospital being what's called over the years the Shreveport model, one that I've just been told at some point has sent as much as $1.3 billion to bail out big charity in New Orleans back in the 90s. The way in which they managed to make that type of income with the dollars given to them by the state is that, unlike big charity in New Orleans, people in this region who have insurance, who pay for their health care from their own pocket, or have Medicare, make the choice to go and get their health care at University Health. You've heard the senator talk about that. More explicitly, you've seen people like Virginia Sheehy, Erin, other high-ranking, wealthy folks within this community who recognize and sought out high-quality health care at University Health Hospital. That results in substantial additional revenues that have poured into that hospital over the years. And as I said earlier, rather than using that to grow the institution, they refer to the University of Alabama at Birmingham as a university that ate Birmingham. The LSU Health Center here in Shreveport should be consuming all of our inner core, that whole Kings Highway, Linwood corridor, all of that vacant, dilapidated land should be at this point part of an entire complex that is doing research and housing clinics and growing the economy and providing jobs and generating wealth within this community. But it's not allowed to do so because the way in which we have operated out of Baton Rouge for so many years is that we allow the money, the wealth, the revenue to be generated in Shreveport, and then we ship it down to Baton Rouge and New Orleans.
Mr. Dardenne,
just given our current circumstances right now between University Medical Center in New Orleans, that safety net hospital, and the one here, we take $200 and some odd million and generate over $400 million. They take $400+ million and end up with less than $100 million in the same private pay that Shreveport generates over $400 million for. That's the $400 million that could end up being diverted to Willis Knighton if they're allowed to step in, move BRF out the way. They manage to end up being the recipient of that additional private pay, and we end up with University Health becoming the Shreveport version of big charity, where instead of having private pay people, insured patients going there, it ends up simply being the hospital of last resort for the indigent and the dispossessed.
Mr. Dardenne told us on Friday that two things. One, that the state, i.e. the governor, hoped that they could work out a solution with Biomedical Research Foundation. He said part of that solution, he said to us that part of that solution would not be Willis Knighton. Do you take him at his word?
No, I don't. because you've already heard the local senator and others here who have talked about the nonprofit that they've already got ready to go, that is willing to step in at a moment's notice, that nobody at the public level, not I as a legislator or other members of this delegation, know anything about. From my perspective, that probably serves as a straw man that gives some layer of anti-trust protection to the governor and the commissioner and the Willis Knighton folks, and allows them to be able to move forward with what their plans apparently have been all along.